Hello, today we are going to discuss dysdiadochokinesia, or DDK. The objectives for this presentation are to understand what dysdiadochokinesia is, understand how to test for DDK, being able to identify what DDK looks like, and being able to understand the safety issues involved with DDK. What is DDK? Dysdiadochokinesia is an impaired ability to perform rapid alternating movements, such as bilateral forearm pronation and supination, or bilateral hand grasp and release. The patient's rapid alternating movements are irregular, bilateral hand movements cease to be simultaneous, and often one extremity will lag behind the other. This is a sign of cerebellar damage, for example, a traumatic brain injury, or from a cerebral vascular accident. It is important to note another term called adiadochokinesia, which is similar to DDK, but it is more severe. When dysdiadochokinesia means the impairment of rapid hand movements, adiadochokinesia is the complete inability to perform rapid hand movements. Simply put, adiadochokinesia means a person will not be able to do rapid hand movements at all. DDK just means the patient has impairment. Here's an example of a woman performing pronation and supination with her wrists clasped together, and then she'll do pronation and supination on her lap. You will see that one of the extremities is slower and jerkier than the other.
Now I want you just to pat front, back, front, back, front, back. The other side.
Here are a few different ways in which to test for dysdiadochokinesia. There is one most common way to perform a DDK test, and there are a few other options you may need to know if you need more help identifying if a patient has DDK or not.
So right now we're going to be filming the most common method for dysdiadochokinesia. And the first method, I'm just going to have her do bilateral hand movement, pronation, supination, and we're going to see if she's synchronized. And then the second one, we're going to test her unaffected side first, and I'm going to count for 10 seconds how many pronation, supination cycles she can do with one hand. And one cycle is just a pronation and supination, and that's one cycle. And I'll be counting that for her unaffected side first, and then I'll be doing her affected side next, and she should be doing that a little slower. At a 90-degree angle, just like so, okay? And what I'm going to have you do is put your palms down, and then your palms up, like so, and I'm going to have you do that with both hands, and I want you to repeat as fast as you can, okay? Okay? All right, so make sure to keep them in at your side and do them both at the same time. All right, go ahead. Can you go any faster? Very good. You can stop. Okay. All right, and now what I want you to do is I want you to use this hand, your unaffected side. I'm going to have you use this hand, and I want you to do this movement for 10 seconds. Okay, as fast as I can? As fast as you can. Okay. Alright, stop. Very good. You got 12 on the hand. Okay. Alright, now do this hand. Alright. Very good. Very good.
Here are some other tests you can use.
Alright, so now what I'm going to have you do on the bed is just place your hand right here, and I'm going to have you do kind of a fast movement with your hand, okay? By just laying down right here, I want you to put your palm down on the bed, and then I want you to put your palm face up, and I want you to do this as fast as you possibly can. Okay?
Okay.
Whenever you're ready. Very good. All right, so just put your left hand up here, and what I want you to do is just tap your hand really quickly on the pillow as fast as you can. Very good. And now put your left or your right hand up, and now do the same thing. Very good.
And keep in mind, during these videos, Amelia is doing the correct way to do the movements, but she was trying to do slower hand movements, which is trying to duplicate what it would be like for a DDK patient, but it's very hard to imitate that type of movement. There are some common safety issues that could kind of arise, especially with fine motor skills. Many problems that arise are due to the inability to pronate and supinate their hand quickly, such as screwing in a light bulb, opening a jar, or unlocking a door with a key. So again, here are the objectives we had, and I hope that you understand what DDK is, you understand how to test for DDK, and you know what to look for, and also some safety issues involved with dysdiadochokinesia. There are my references. Thank you very much.